Hi everyone. My name is Waleska Wells. I'm with the Center for States, and this is the webinar, How the National Center for Enhanced Post-Adoption Support Can Help You Meet the Needs of Children and Families. I'm going to go over some brief housekeeping. This event is being recorded, and the recording will be shared with members of the foster care managers and adoption managers peer groups. It will also be posted on the website of the National Center for Enhanced Post-Adoption Support. This webinar will be interactive. Please use the chat to post questions and share thoughts and comments throughout the webinar. The slide deck recording and any additional resources will be sent out 1 to 2 weeks after the event has occurred. If we are unable to address all questions during the event, we will answer the remaining questions in follow-up communication. And last but not least, we do have an evaluation survey that will open once you leave the event. Please take a moment to provide us with your feedback. It should pop up in your web browser. And with that, I will pass it to Alicia Groh to begin. Thank you.
Great. Thanks so much, Valeska. Hi, everyone. Welcome to our webinar. I'm Alicia Groh. I'm National Authority Consultant with the Capacity Building Center for States with a focus on adoption. And I am jumping up ahead a bit in the order you see listed on this introduction slide. Unfortunately, June Dorn, the National Adoption Specialist at the Children's Bureau, is sick and not able to help do a welcome here. So she asked me to do a welcome on her behalf. She is really excited that we have today's webinar to really highlight the work and the opportunities that are available to all of you from this National Center for Enhanced Post-Adoption Support. This is one of 3 new national centers that the Children's Bureau funded in the past year to keep building capacity and really doing important change and working to improve outcomes in states, tribes, and territories. So June, sorry she can't be here to welcome you to this. Also, I want to just, on behalf of June, I want to also note that Jennifer Lee, the National Foster Care Specialist at the Children's Bureau, also welcomes you to this event. They are both excited to be able to have us offer this series of webinars we've been doing for adoption managers and foster care managers to highlight these national centers. So they are glad that you're here, and we all appreciate you joining us today. Let's go to the next slide. I'm just briefly going to give you a preview of who you'll get to be hearing from in the next few minutes, and they will introduce themselves more as they start their presentation. But we have today from the team at the National Center for Enhanced Post-Adoption Support, Melinda Liss, who's the Vice President of the Academy at the Spalding for Children. At Spalding for Children. Dejari Patterson, the Post-Adoption Center Repository Program Director, and also at Spalding for Children, and Sharon Vandeveer, who's the evaluation lead for this national center, and she's a senior research scientist in child welfare program area at Child Trends. So you'll be hearing from all 3 of them in just a few minutes. Let's go to the next slide. So our agenda today is pretty straightforward. We've done our welcome, we've done brief introductions. The focus for this time really is for you all to get to hear from the National Center for Enhanced Post-Adoption Support and to learn more about how they can support you, and for you to be able to ask questions, interact through the chat with the National Center team and with each other. And then we'll just have some brief closing and discussion about next steps. But really, we want to make sure we carve out the bulk of this time for you to hear from the National Center team. Let's go to the next slide. And so our learning objectives for today's session are pretty straightforward as well. One, we're hoping that as a result of participating today, you will have increased awareness of how the National Center for Enhanced Post-Adoption Support can support child welfare systems, and that you'll have increased access to the services and resources that are available from this National Center for Enhanced Post-Adoption Support. So with that, I get the pleasure of handing this over to Melinda to get us started.
Thank you so much, Alicia. I appreciate it. My name, as Alicia said, is Melinda Liss, and I am one of the vice presidents at Spalding for Children, which is a not-for-profit agency out of Detroit, Michigan. And for those who've been around in the field a long time, you know that Spalding for Children had the National Resource Center for Adoption. So we're thrilled to be able to continue this work. I was able to work at the National Resource Center for a year before it closed down. I've been in the field for about 30 years. I was going to say 20, but 30, unfortunately. And most of it has been in the adoption area, and I'm also an adoptive parent. So I feel very honored and passionate to be able to lead this initiative. All right, I'm going to start the next section off on why post-permanency is important. So we can move to the next slide. There we go. In child welfare, I think it's really important that we ground ourselves, I think, before I begin the overview of the center, because in child welfare, we talk a lot about keeping kids out of the child welfare system, and we talk a lot about children who are in the child welfare system, both of which are critically important. But we don't always spend a lot of time talking about those children who we have taken into the child welfare system and helped to find permanent families through them for adoption or guardianship, and they're living there. And so I want to spend just a few minutes to kind of talk about that, because I think that really lays the importance of why this center is so important and why the work that all of you are doing in your retrospective sites is so important. So on the next slide, you're going to see data from HHS. This is from fiscal year 2019 related to Title IV funding. And I think the most critical thing to remember when we're thinking about this population is it's large, right? So if you look at this chart here, you'll see that the number of children in 2019 who were receiving a 4E subsidy that were either in an adoptive placement or in guardianship is much larger than those that were actually in care. In fact, it's about 300,000 more children that were in adoption or guardianship. And the important thing for us to always remember is that these children are still tied to us in the child welfare system. They're still receiving a subsidy. They still receive a medical card. And most sites are in some ways in contact with them or offering them some types of services. So they definitely are a part of our child welfare system. On the next slide, we'll see about the impact of having a comprehensive post-adoption program. Because I think that in addition to recognizing the size of this population, we also always have to keep in mind that these children have all experienced some form of trauma and loss. And as we know from the research, and I'm sure most of you are very familiar with it, that these children don't just let go of the trauma and loss and some of the challenges that they face from that because they move into an adoptive or guardianship home. In one national study, more than 2,000 children in child welfare, researchers found that 70% of those children had experienced repeated or chronic trauma. They noted that this trauma can affect children's ability to regulate emotions, handle conflict, form healthy relationships, and distinguish a safe thing from a threat. We also know that many of these families do face struggles, right? We know from studies that they've shown as many as 20 to 30% of adoptive and guardianship families do face some kind of significant challenge, which can cause a real toll on the families, including the children they're caring for. Sometimes that can lead to a breakdown of placements. In a recent study that was done by HHS Office of Planning, Research, and Evaluation, or OPRE, reports that 5 to 20% of families may experience post-adoption and guardianship instability, where the children are no longer living in their home. Studies have shown that these challenges remain long after adoption, right? They reach into the adolescent years. And one study that was done or mentioned in the OPRE report, it looked at instability outcomes for a large Midwestern state of about 52,000 children. And in that study, they found that 2% re-entered foster care after 2 years from finalization, 12% re-entered foster care after 10 years. So based on all of these things, I think it really does lay a groundwork or a foundation as to why a post-permanency program that really offers comprehensive services and continues to have some contact with families over the time is really important. And the impacts that that type of program can have on families and what the research has shown is listed on this slide. We can go to the next slide. So some of you may have been familiar with the post-permanency continuum framework that was developed as part of the Quality Improvement Center on Adoption, Guardianship Support, and Preservation. Very long name. This is a very similar type of continuum. We've taken that and kind of adapted it. And I think the reason I wanted to show this is that we also have to realize that every family is unique, and that their challenges or their situations are going to ebb and flow over time, which may result in them needing something more intensive that you see on the far right of that continuum, And sometimes all that's needed is more universal outreach. But whatever the mode is, it's important that sites really look at how they provide these services in a very comprehensive manner and that reach families at different stages where they might be. And of course, in the middle of that dial, we have maintenance, because anytime we're working with families, particularly if we're investing time, resources, and staff to really stabilize them, we want to continue that contact with maintenance to ensure that everything is stable and good. The Post-Adoption Center that I'm going to be talking about now is really designed to help states to move to having a comprehensive post-permanency. So we're going to move to the next section and really talk about what is the center, and I will provide a quick overview, and then we're going to go into depth into 3 different areas, and Dejari is going to go through 2 of those areas, and then I'll follow up with the last area of kind of more in depth of how this particular center can help you. All right, we can move on to our leadership team. This is a collaborative agreement, collaborative too, but a cooperative agreement. And Spalding for Children is the lead for this particular initiative. All the agencies that are listed on there are part of this partnership, all critical to the program. Today, we are being joined only by one of them, which is Child and Trends, but all of them play a critical role in our process. As Alicia mentioned earlier, June Dorn is our federal project officer, so we work very closely with her to ensure that we're meeting the FOIA that came out from the Children's Bureau, and that we're really holding to those goals and the objectives that they had listed when they came up with this particular initiative. And this is a 5-year project, I should mention. We just started in October, and we'll be continuing from 5 years from that time period. Okay, next slide. This slide provides an overview of the Post-Adoption Center. I won't read that, but I'll just highlight a few things that are listed on this slide. We really are intended to serve as a hub for post-permanency expertise for states, tribal nations, and territories. And for the most part of this presentation, I'm going to refer to states, territories, and tribal nations as sites. It's just easier. So if I say sites, I'm referring to all 3 of them. Our target population are the child welfare professionals who work in those systems. They could be private agencies or public agencies, but always we're going to interact with the state, the county-based system, the tribal nation, or the territory as our primary conduit. Our services, of course, are free because they're offered as part of this cooperative agreement. And we want to support sites to really enhance and implement comprehensive post-permanency programs like that continuum that I showed you just a few slides back. And we're going to do that through 3 main avenues. One is on-site technical assistance, which I'll go into detail kind of at the end of the presentation today. Universal technical assistance, which is going to be covered by Dejari, and this is going to be, this ranges from center chats, peer-to-peer groups, to sites calling and needing some assistance with something that doesn't really fall into the on-site technical assistance more intensive bucket. And then Dejari will also cover comprehensive resource library, which is already up and going, and it's a great way for sites to be able to get information at their fingertips, to reach out, talk to somebody, to even try to get information sent to them that they may need about a particular topic. But we'll go into those in a little bit more detail in just a few minutes. But before we get there, we'll move to the next slide, because it's important to show that there's really no wrong door to get technical assistance. You know, we're really trying to ensure that we can meet the site's needs where they are, and that there are many avenues in which they can access services, and we want to ensure that all of them are wide open. We're very aware, we're working on several initiatives right now outside of this project, so we're very aware of the fact that sites have a lot on their plates. There's CFSRs are up and going right now. So there's a lot of work going around related to that. There's certainly a lot of other initiatives taking place, and there's a lot of still workforce issues going on. So we're very aware of the fact that for many sites, it's a very small group of people who continue to do these different initiatives, and therefore the ability to take on something new, even though it might be great, can be challenging at times. And so we're trying to really alleviate that by really being a partner with the sites and being there not just to come in and to try to say, oh, do this or go here, but to really partner and shoulder a lot of the work related to this type of technical assistance with the site so that we do it together. When we do go in and work with the site, particularly related to on-site technical assistance, we will have a team of staff who have an expertise in post-permanency services, and they will go on and really work with that site over a period of time. And that time will vary based on what the site is able to implement and their capacity, but we're looking at anywhere from 18 to 24 months. I want to also mention that there are 2 other centers, as Alicia mentioned earlier, that have opened up, and we're working very closely with them as well, because if we can work together and we can offer a streamlined version of assistance that really goes through all of our centers, that's the best way to do it. So we are working hard to do that as well. Next slide. So I did say this already, but it is important because we've gotten some calls already. We are really there to service child welfare professionals, right? So we are trying to provide child welfare professionals with tools, information, support, assistance that they need to be able to provide the best services they can to families in their own sites that are in post-permanency. Certainly our resource library is open to anyone. We know that we've already had people access it who are foster adoptive parents, as well as the community in general, and that is fine. But we just wanted to make sure that all of you on the call were really clear that our target audience is really those people who are on this webinar. And that's who we'll really work for, so that we can provide them what they need to do the work that they need to do with children and families. On the next slide is actually a poll, and we're going to go straight into the poll because it's a pretty easy one. But this is something that, in the past, really adoption program managers were the main people who headed up the post-permanency services in different sites. But we are now hearing that there are other types of people who are heading that up, and many people are sharing different hats. So if you can fill out this quick question, the question is, who oversees a post-permanency program in your state, tribal, nation, or territory? Adoption program manager, post-permanency program manager, and if you list other, if you don't know, you can hit other and just put I don't know. Or if you do hit other, if you can specify who it is, I think the poll will allow that. That's great information for us because I know there's been some changes related to how this is being done. And I'll give the poll just one more minute to go through. So if you haven't done it, please do it. All right, I think we can go ahead and show the results of the poll. So people should be able to see then that the adoption program manager still seems to be the primary person in the sites who are working on post-permanency program with a post-permanency program manager behind there. And then we'll look when I get to see the data, we'll look to see who the other is. So I appreciate you sharing with that. I am now going to turn it over to Dejari Patterson. Dejari works for Spalding for Children as well. I'll let her introduce herself, but she's going to go in depth with you about how the resource library can help you and then move into how universal technical assistance can help you. Dejari.
Well, good afternoon, everyone. Again, my name is Dejari Patterson. I am the Resource Library Director for the National Center for Enhanced Post-Adoption Support. As Melinda mentioned, I work for Spalding for Children. So it is great to be with you all this afternoon. So I am sure one of the burning questions you had today was, how can the Resource Library help you? Well, I am so glad you asked because I'm here to give you that answer. Next slide. And so our comprehensive resource library currently has over 300 resources. So you can choose from articles, reports, webinars, videos, you name it, we have it. It's a living library. So we're going to add resources every month. So you can log in today, or you can go to our website today and you can see some of those resources. And then when you log in April, you'll see even more resources. So we encourage you to visit the resource library on a regular basis, because we'll be updating it and adding resources very regularly. You're able to use our sophisticated search feature. So whether you're looking for a keyword or you want to filter for specific format types, you could do that as well to have a more concise and narrowed down search. And then, wouldn't you know it, you have me, your personal librarian, who can assist you with making connections to your peers and colleagues across the states. Or if you're just looking for something specific and you didn't see it in the library, you can email me or you can chat with me and just ask me questions, and I'll look up information for you and see how I can best assist you. We also have a catalog with promising practices and evidence-based programs that can be used for your post-permanency population. So when you visit our website, you'll see the resource library tab, and then you'll see program catalog. And that's where you can access those promising practices. Next slide, please. I know that second burning question you had when you registered for this webinar was, how can Universal Technical Assistance help you? Well, again, I'm glad you asked, because now I'm going to answer that question. Next slide. So with our Universal Technical Assistance, we offer our chats, our center chats. We'll have webinars and peer groups, as Melinda mentioned, and you'll also have that individualized assistance to help you find resources. Again, yours truly, your personal librarian here. And so we'll help you look for resources related to information for post-permanency. Next slide. So our center chats, very casual. We still want you to be able to learn, but be relaxed. You'll be have information presented to you by our child welfare experts, and they'll last about an hour. So not too long, not too short, but they're interactive and very engaging. So we want to make sure that not only are you hearing from our child welfare experts, but that you also have an opportunity to hear from one another and your peers and colleagues across the nation. So our upcoming chats for this year include understanding how trust-based relational intervention, or TBRI, benefits post-permanency programs. We have adoption and guardianship preparation, great expectations and beyond. We'll also have a center chat on mental health needs of teens post-permanency. And last but not least, we'll talk about when to co or share parenting in kinship families who have adopted or obtained guardianship. So we hope to see some of you in our center chats real soon. Next slide. Next, we have our webinars. Again, a virtual learning environment. We want to build your knowledge and awareness of the Post-Adoption Center. And so this year, that's what our focus is going to be: getting adoption program managers, foster care managers, and child welfare professionals familiar with the services of the Post-Adoption Center. So our upcoming webinars include an overview of the Post-Adoption Center and our services. So a little bit more in-depth information than what you're getting today. We'll also have an in-depth look at the technical assistance that'll be available to our states, tribal nations, and territories, followed up with another in-depth look at the contents of the resource library. And then last, we'll end this year's webinars with technical assistance offered specifically to our tribal nations. So again, we look forward to seeing you all on some of our webinars coming soon. Next slide, please. So our peer groups, these are open again to our child welfare professionals only. You must register for a peer group. Now here's the catch. You want to register early because space is limited. And so we want to make sure that you join the peer group that you're most interested in. So please make sure if you see one that comes up to go ahead and register. We'll be focused on the interaction between peers because that's what a peer group is for, to give you that opportunity to share information, to brainstorm with one another. They will be facilitated, but the most important thing that we heard from a lot of you all is that you want them to be solution focused. And so that's what we'll do. We'll have solution focused conversations instead of just going back and forth peer groups. So we're going to pilot this, and it'll start off as a 3-part series on a specific topic. So your first session will include an expert on the topic who will provide an overview. That's kind of your educational entrance into the peer group. Your second and third session will be a facilitated conversation. And this is where you'll hear examples from other sites, again, from your peers and colleagues about how that particular topic has impacted them or the information that they need to get to better improve on whatever topic we're discussing at that time. And so there will also be opportunities for ongoing connections and interactions with your peers after the group concludes. So we want to make sure that there's networking going on, that you all are able to remain connected and talk with one another outside of the peer group. Next slide, please. And again, we'll have individualized assistance. You can chat with me. So when you go to our website at postadoptioncenter.org, you'll see a little chat icon. You can chat with me Monday through Friday from 10 a.m. to 5 p.m. Eastern Standard Time. You can ask any questions, ask me to look up resources that you may not find in the resource library or just may not have time to peruse. Or you can send in a request to add some information or a particular topic to the resource library. You also have the option to request what we consider light technical assistance. So maybe your site or your state is not quite ready for the full on-site technical assistance, or you're not ready to have your assessment completed, but there may be some things that you just want some short-term guidance on. So we're also able to provide that to you as well. And then, as I mentioned, that resource search. So maybe you don't have time, maybe there's a particular topic that you're looking for. Please make sure that you chat with me, or you can email me for the information that you need, and I'll get that information back to you. Next slide, please. And so now I'm going to turn it back over to Melinda to talk about on-site technical assistance.
All right, thank you so much, Dejari. It's hard to go after her because she's so peppy. But everyone should want to talk to her, right? Because who doesn't want to talk to someone? And she's like that all the time. So it's awesome. Definitely reach out. We've started both of those things already. So we are already working with sites on some universal technical assistance, and we're also already getting some requests for the resource library for various things. And just to give you some examples, someone had wanted to know from a state about different respite resources and getting some articles related to that. So Dejari worked to compile some stuff for them so they could have that information. We had another site who requested us to get involved with some of the planning that's going on in their state related to post-permanency. And so that's something that we've started as well. So please do reach out for both of those. I'm now going to spend time talking about the third avenue, right? Because I said there were three main avenues of how to get help from the center. One is universal. One is the resource library. And then the last one we'll talk about is on-site technical assistance. And we'll spend a little bit more time delving into this because it is kind of the cornerstone of the work that we're doing at the Post-Adoption Center. Okay, next slide. As the graphic shows here, and you've probably heard me say many times, and Dejari, that partnership is really key. I'm a big believer in that. I worked for a state system for many years. I've been on the other side. And so it's really important that we work closely with the site. We listen to what they're wanting to do, and we figure out ways that we can help them to accomplish that. So we want to be there to really build their post-permanency continuum. We want to be strategic about how that's being done, and we want to do it in partnership. As I mentioned, we'll have a team that's developed that goes in to work with the site when we start to do on-site technical assistance. And that team is going to consist of 3 consistent agencies that will always be involved with all of the technical assistance on the ground. One of those is going to be Spalding for Children. We have a lot of expertise related to implementation and how you really manage these kind of projects within a site. We also will always have Harmony with us, and Harmony is an agency out of Tennessee. They provide all of the post-permanency program for that state and have a long expertise in meeting the needs of children and families post-permanency. And we're also always going to be bringing in CASE, and CASE is out of Maryland. Most people are probably familiar with that. They do a ton of work and are known as experts in regards to post-permanency and adoption. And they are working with 2 states, Maryland and Virginia, where they're providing post-permanency services. So these 3 agencies will always be coming in. It will be the consistent players that show up with the site so that we're not changing team members, because that can be very difficult for everybody. But then we'll have the other partners who will kind of drop in as needed. So for instance, Child Trends is really going to head up the CQI work, which is really important. We want to know if the programs that are being put in place are working. We also want to make sure that sites have a way to track children and families that have moved to post-permanency that might be re-entering their system. So Child Trends would be brought in to help with that piece of it. We might bring in Raise the Future because they have a lot of expertise in post-permanency, but they also have the ability to train TBRI with sites. And that's one of the things that I'll talk about that we offer. Or we might bring in the National Adoption Association, who's really heading up our DEI component, so that they can really look at who are the families and children that are needing services in your site, and how effectively are we able to reach all of those families that are from different ethnicities, races, and culture. Next slide, please. So the Post-Adoption Center will be providing technical assistance on site to 5 sites per year, and that will be starting this year. Because we are trying to get everything in row, everything in, I can't think of the right word, everything built before we go out to a site, so that when we go out to a site, we are fully formed and ready to go. We are not going to start that type of on-site technical assistance until June. So that's not that far away, which is hard to believe, but we will be working with 5 sites and we will be identifying those sites around June and then starting to work with technical assistance with them. As I mentioned before, it could be anywhere from 18 to 24 months. It really depends on what we're doing and what capacity the site has for that type of TA work. Overall, when this project is over, we will have worked with 25 sites. And so for those, well, I'll get to that in a minute. We'll come back to that. And bullet number 2 is really listed the intent of the Post-Permanency Center, or the Post-Adoption Center. And it mentions these pillars. If you notice the graphic, there are 5 pillars here, and I'm going to talk about those in a minute. And the graphic will be a little bit larger, but it's the important thing to recognize here is that we're really going to work with sites to develop, implement, and sustain a comprehensive intensive post-permanency program. And those pillars are going to be part of what we're doing in our assessment and also as we work with the sites. Next slide. So although we are not going to start doing the actual technical assistance until June, we are already doing informal meetings now. We've been reached out by a lot of sites so far that are interested in just kind of getting a better information about what this is, to talk about what they're looking for. And really, this is like a pre-meeting, pre-game. And so I would encourage you that if you go to this webinar and you're like, well, I'd like to hear a little more, I want to talk specifically about my site, just reach out to me. My email is there. I'm more than happy, and Alicia's just put it in the chat too. We're more than happy to have these conversations with sites, because as we start gearing up for June, as we talk to sites now and we start identifying sites that really, they want to move forward with this and they're very excited about it, we want to go ahead and get them ready to go. there's no obligation, I should say, either for that. Some people feel like, oh, if I call them, then I'm going to be obligated to something, but that's not true at all. It's just a friendly conversation. All right. So on the next slide, we'll see how a site benefits from technical assistance. So there are many things listed on this slide as to how our technical assistance on site can benefit your site. I will highlight a few of those. Of course, our main goal is that by the time we walk away, the site has a more comprehensive post-permanency program that not only helps to stabilize families who've achieved adoption and guardianship, but ensures that families who are thinking of moving to permanency, that they'll feel supported and comfortable about making that move. And I think that's really important. We forget sometimes families talk, right? Small world out there. And families who achieve permanency that feel like they're supported and that they have the services that they need to maintain the child in their home safely and effectively for everybody, they're going to talk to families who are thinking about becoming foster adoptive parents. They're going to talk about families that are in the system who are making decisions about permanency. And so it's really important that we provide this continuum from all the way from the very beginning to the very end. And I'll talk about that again in a minute. There's also a lot of tangible benefits that we're going to be offering, some of which I've already mentioned, but I want to highlight again. We do have the ability to provide TBRI training in sites that's part of what they want to do for their post-permanency program. So that would be a free thing that would be offered to sites. We also have the ability to offer TAC, which is offered by CASE, and it's considered kind of like a higher level or more intensive than NTI training. So that's something that we also can offer to states for free. The next thing that's listed here, people may not be as familiar with. It's the groundwater analysis training. And it's an excellent program that really looks at diversity, equity, and inclusion within your own site and starts a conversation going about how you further that along within your systems of care. And that's something that we can also offer for free to sites. In addition to that, we are really set on creating shared learning environments between the sites who are getting on-site technical assistance. I know that sites like to talk to each other, and they learn best from hearing what other sites that are similar to their site is doing. And so we want to make sure that we offer that in different ways. And so we'll be having some times where we bring all of those people who have gotten on-site technical assistance together for an in-person meeting to really be able to share, talk about what they're doing, highlight their programs. We also will be pairing up sites so that if a site is interested in one area of post-permanency and we know another site has recently done that or worked on it, we'll be pairing them up so that they can really start forming these very collaborative relationships. And then, of course, the biggest benefit that we hope to offer is that we'll have less children who are coming into the child welfare system, which is truly prevention, and that those children who are in post-permanency placements have positive well-being outcomes. All right, so on the next slide is our framework for site identification. So hopefully people are excited and they're saying, yes, sign me up for on-site technical assistance. We want to know how to do it. So I'm going to tell you how to do that. I think it's important too to mention before I go into this that this is not a pilot program. So that means that there is not going to be, if you've worked with Spalding before, you may know us more as an entity that does pilot projects where we select only a certain number of sites and we work with those sites very intensely over the course of the period. This is kind of old-fashioned technical assistance. So any site can come forward who is interested, and we're not going to turn people away. We just may have a capacity issue that we have to kind of work with you a little bit through more universal or put you on hold for a short period of time until we can put you in as one of the 5 sites. So the 2 ways that a site comes to us, which is the little blue ovals on the far left side, is either through a self-referral or outreach. And a self-referral means that the site just reaches out to us. They can do that on our website. There's a place that you can put in there if you're interested in technical assistance. It goes to a person on our team who's monitoring that regularly, and then we reach out and have conversations with you from there. It could also happen that you just call us, like these exploratory meetings we're having right now, where people are, I call it putting their toe in the water. They're just trying to figure out a little bit about what's going on. You could do that and from there have a self-referral. We also will be doing some outreach because as we've been going along, we've been collecting a lot of data about all of the sites so that we have a good idea of things that people have put in their CFSRs or their PIPs or their ASPRs related to post-permanency, so that if we see a site where we feel like it really aligns well, our mission with what they're trying to accomplish, we'll reach out to those sites as well. But either way, the first step that we move into is an exploratory meeting. And the exploratory meeting is very informal. It's like an hour-long meeting. We do need people from the state, the tribal nation, county system, or territory to be on that call. So sometimes I get calls from private agencies that are working in sites that are providing the post-permanency services. And that's very common in many sites, but we can't deal directly with them. We have to go through the state, county, tribal nation, or territory, but they certainly can be at the table as well. So we'll need to have a few of these decision makers that are there at the exploratory meeting. This will be a remote meeting, like an hour long, and it's really a time for us to talk a little bit more about what on-site technical assistance means for your site, what it would look like, what would be the steps in the process, and then to get an idea of what it is that the site's looking for. Because it's a two-way street, right? You have to know what we're offering and we have to know what you're wanting to see if we can meet that need. And from that meeting, sites can kind of make two decisions. They could decide, which is the top blue, that they're not interested or maybe just not ready at this time. You know, other priorities, or they'd like to get back to it, but maybe not right now. And so they could continue to access services through all of the wonderful stuff that Dejari talked about, through Universal Technical Assistance or the resource library. And maybe later they'll come back and say, now is the time. However, other sites, if you follow down the graph there, are going to be interested and they're going to say, you know, we want to have another meeting to really hear more about this. And that moves us into what we call the Tier 2 meeting. And the Tier 2 meeting is a little bit more formal. It could be in person, it could be remote. I mean, I think that's going to be something that we'll have to work with the site on, but that'll be a longer meeting, more like 2 to 4 hours, I'm going to say, just to be safe right now. And during that time period, we'll go through a more formal presentation of really what this looks like, what it means to be an on-site TA, what are the expectations of the sites, how would we help you? And then likewise, we want to get a lot more information from the site. And if you look at the box on the right that says Tier 2 meeting, those are the kind of things that we're going to be looking for. You know, we'll have it more formalized than this, but it's basically this kind of information. So we really have a good idea of what the site is wanting to move forward with. And then again, at the conclusion of that meeting, that we may decide there needs to be some discussion that goes on and they might get back to us, but ultimately a site will decide right now is not the time. And again, they go back up to continue to get all the on-site stuff. I mean, the Universal Technical Assistance and the resource library, and other sites will move forward and say, we are interested. And when they make the decision that they are interested, you'll see in there that there will be an agreement that we sign, which is very typical for this type of stuff, that lays out what we'll do, what we expect from the site, and kind of the parameters of that. And then the first thing we'll move into is an assessment. And I'll spend some time in the next couple slides talking about the assessment. But the assessment is going to be a process where we can really look at what's being offered right now. Every site's doing something post-permanency. So what's being offered right now? And then we want to also interview key stakeholders. We want to interview child welfare professionals that the site identifies. There may be groups like adoptive groups or foster parent groups that they want us to talk to. We'd like to interview some stakeholders out there in the community that may not actually be getting services or are super involved with the system, but reaching out to them to find out what they see the needs are. We'll look at data, policies, practices, and we'll gather all of this information and come back to the site with some type of a report that says, here's what we found, and here's how it compares to what we're trying to do with this post-permanency continuum. And we'll then have a discussion. And if at that point the site says, we want to move forward, we develop an action plan and we begin to work with them on actually moving forward to do some of the things related to the post-permanency continuum. All right, next slide, please. So this is the pillars that we saw earlier, and I want to spend a little bit of time kind of unpacking this, because this graphic, I think, helps to explain the assessment that we're going to do with the site. But it also, because this will guide, these pillars kind of guide the assessment, but it also kind of tells you what our post-permanency continuum really is built upon. So the first thing I think to mention is that we're really looking at a comprehensive services. And I showed that graph earlier that showed different intervals, everything from universal moving up to intensive. And so we really want to look at the site's overall system of what they're offering to children and families, from starting at the outreach they do with families all the way to what they do when families are more in crisis. I hear consistently, I would think, from many states that they're most interested in trying to get to the families early, right? Everybody wants to try to figure out, how do we get to the families before they're knocking on our door in a crisis situation? And so we really want to spend time kind of looking at that whole continuum. In addition to that, as you see on the bottom of this pillar is Adoption Competency Foundation. That's really key. We want to ensure, we want to look to see who's providing the services in the post-permanency world in your system, because certainly having staff who are really trained and are adoption competent, which means understanding trauma, separation, grief, and loss, that's really a critical part of this. And so we'll do things to help a site to get further along in that process. That'll be part of our action plan if this is an area that they need some help in. And that can be done through connecting them with NTI, by offering them TAC. We also want to look at some of the programs that they're offering to families, because in addition to the staff understanding all of this, we also know how important it is for families to have a strong foundation of knowledge. And that really starts when they first enter the child welfare system, and we train them in a way that they understand what trauma, grief, and loss is. They understand the importance of connections to the birth family, regardless of the permanency outcome, and all of these other critical things. So we want to start them with the best knowledge, and then we want to make sure that they have that consistency and ongoing training while they're in care, so that by the time they reach permanency, they really have solid grounding. And that's really critical, I think, as we look to really achieve successful permanency. Now, going through each of the pillars, I'll just tell you briefly what they're really resembling, or what they're, I guess resembling is the best word I can think of right now. So available and accessible is the first one. We want to make sure that the services that are offered are available and accessible for all families, regardless of their of where they live in the state, regardless of their culture, their religion, their ethnicity. We want to make sure they're available and accessible. And part of that means we have to figure out how to outreach and make sure families know about the services that are out there. So really looking at a site as to how they let families know about the services, and how they kind of keep that information going out there to families will be really important. The second thing we're going to be looking at is engaging families over time. I mentioned earlier about really the re-entry became much larger as children entered, or became greater as children entered the adolescent years, which was like 10 years after finalization. So how we engage families over time is really important. It's not just about giving them information one time about post-permanency and then thinking it's good, but how is the site really working with those families and connecting with them and making sure that they have some kind of consistent touch on them at different types of touches over time, so that when families feel like they need to have something, or they start to wonder, where could I get services, they know exactly where to go. The next one is focused on parent-child relationship. And this is critical, right? Because we know that adoptive and guardianship families, the most important thing we can do is to really ensure that those families have the knowledge and the information and know how to connect with their children and can provide a stable, nurturing environment. So we'll be looking to see how is this site really ensuring that the whole family system is being worked with and that parents are being given the tools and the information and support that they need to really be able to provide that type of nurturing environment to children. This is where our TBRI comes in, because certainly that's a cornerstone of TBRI. And that's one of the things that we can offer to sites. The next pillar is able to assess family outcomes. And this is really about kind of the tracking. We've been having a lot of conversations with regions about tracking children and families so that sites can really identify when a child is coming back into their system, or when a child might be in a residential placement, or when they might be in a psychiatric hospital and maybe being touched by another system within their site. And so we want to make sure that there's really good tracking that's done related to making sure those families can be identified. Along with that, I would say is CQI, because if we offer a lot of programs, but if we don't know if those programs are meeting the needs of children and families, if we don't really know what the needs are that people in your site are saying that they have, then that's information that's going to be not there to really understand what services need to be put in place and how we can improve them. So we'll be looking to see what the site's doing related to this, and then we'll also find ways that we can help them with tracking. Data is kind of the number one thing that we need for service provision, and to really make sure that we can then explain to people higher up than us in the sites about why this is so important and how we're helping them. And then lastly, culturally responsive. We want to make sure that we're not just providing services, but services are being offered in a culturally responsive and accessible manner. So when we go out to do the assessment of the site, we'll be looking to see who is their population of adoptive and guardianship families, and then who's coming to services. Are there populations that we're missing? Are there stakeholders who don't feel comfortable getting services or feel as though there's something that prevents them from being able to do that? And then how can we ensure that we have the services that are available linguistically to people that are within your site as well? So that's a lot, and that's all of the pieces of the pillars that really kind of hold up our model, which I'm going to show you next, but it also really guides the assessment that we'll be doing with sites. So on the next slide, you're going to see the essential components to the post-permanency model. So there is a model that we will be talking to sites about, and when we go out to assess them, we're going to be looking at what they're offering, and we're going to be really kind of holding it up to this, what I would call the gold standard that we really hope sites can move toward. We want to ensure that sites have this comprehensive model, and we'd like it to contain all of the 7 components that you see listed on the top of this arrow going across. I like to, this may not work for you all, but I'm going to use it. We'll try it. You can put in the chat if it works or not. I like to talk about the mall because I think it's an easy way to think about this. You know, in the old times, we used to have malls where you would go in and all the shops would be there and you could get everything you needed in one location. Now it seems like those are kind of going away, and people are going all over town to get different types of services that they need. And I kind of akin this post-permanency model to be like one of those old-fashioned indoor malls. So we want families to be able to come to the mall. We're going to have some type of an intake, which is listed on the bottom. And the intake is really just kind of getting a read, because the families are coming because they need something. And so we want to figure out what it is that they need. We want to figure out if they're in crisis, and we want to be able to give them a diagram of all the stores that are in our mall. And then we want them to be able to enter the mall and do shopping at all these different stores. And the stores would be the components that are listed on this slide. They don't have to go down the street. They don't have to go to another agency. Everything is really right there and kind of streamlined for them, so they can get educational advocacy. They could get support groups, respite services, and all of it's provided right there in that mall. And so that's what we're really going to be looking to try to move sites toward, is having this type of comprehensive model that allows families to have this kind of streamlined service provision where they can access services. They may not shop at every store, but they certainly have all of them available to them. And they'd be able to continue to get this support for quite a period of time until they reach stabilization and they're able to then leave the mall and feel like they have everything that they need to be successful. So please put in the chat, let me know if that worked. I don't know. I might have to improve that depending on how it flies with people. But I'm going to briefly tell you the components of these, the different components of what they are. I won't go into great detail with them. I will say that we're developing right now a model that we're going to put out, or a manual, I should say, a manual of the model. And we will put that out probably within the next 2 months. And that's going to really go into detail and provide examples of what each of these components are so that you can look at it anytime you want. It also will be given to all the sites we work with to provide on-site TAs so that everyone understands kind of what we're trying to work toward. So the first thing we have is pre-permanency supports and training, and that's really getting a family who's about ready to move to permanency to ensure that they have the knowledge, the information of how to access services, what services are available to them, where they can go for help, and that, you know, there's some kind of a handoff that happens to the post-permanency side. And that's really critical because we want to ensure that families at that time really know where to go and how to get services. The second component listed here is standardized assessment. This is going to be a little bit more tied to kind of the in-home counseling that I'm going to talk about in a minute. It's different than the intake that starts at the beginning of the mall because the intake is not a super formalized process that will take a long time because we want to get families in as quickly as possible. But the standardized assessment is going to be a little bit more lengthy. And that's going to be for families where they're having like even a higher level of service needs and probably are going to need more things like in-home services, maybe crisis intervention. And so we need to go through a more thorough standardized assessment of the children in the context of their family. So that's one thing that we'll be looking at. The third component is a 24-hour call center. Certainly we know that these things, a lot of the problems or challenges that families face don't happen between 9 to 5. And so we want to make sure there's some ability for these families once they're in the mall that they have ability to access a person at the time that they start to have a need. And there's all kinds of creative ways to do that. The next component is in-home services, and this includes both counseling as well as some crisis intervention. And the main things to talk about this is that it's really about the whole family, right? So we want to look at the whole family unit. How do we support the parents and ensure that we are meeting them where they are? And that includes providing in-home services and making sure that we can be there and make sure the services are accessible and that we can really get the context of the whole family. And as I'm sure many of you are aware of, there are times that these families will need more crisis intervention. And so making sure that there is something available for the families when they're in that situation that really supports them, walks with them, connects them, does advocacy for them, and then that ongoing maintenance that I had mentioned on a previous slide. The educational advocacy is next. And that one is really critical because we know that a lot of the challenges that children who've experienced trauma, separation, and loss face are in the education system. And so we want to ensure that we are able to provide parents with the knowledge and information to help them become good advocates for their children, but also to be able to advocate with school systems to ensure that children are receiving the services and supports that they need to academically excel. Support groups are really important because we know that peer-to-peer thing is so important for everybody. And so we want to make sure that sites have the ability to offer support groups for the children and youth and also for the parents who are caring for those children. For our purposes, we don't define support groups as being recreational. It's much more along the lines of psychoeducational and therapeutic that we'll be talking about. And then our last component here is respite. And the way that we're defining respite is not crisis respite. We're really talking about respite that is there continuously to provide families with some time for a break. And we're looking at this in 3 different ways. One way is really trying to help the family to get people within their own system who can do this and really give them the information and the training that they need so that their own networks can provide respite. We also recognize that's not always possible. And so we want to make sure that we have the availability to offer some respite to families on an ongoing basis so they can get those needed break to replenish and to be able to come back and be their best for the children and families that the children and youth that they're caring for. And then lastly, we recognize that there are times that, these children and youth really need to have some structured activities that are fun. And sometimes these children and youth, particularly ones that might be having more challenging behaviors, may not be able to do all the other things that children in the community get to do, but they still want to have friends and they still want to be able to do activities. And so having respite services that are really geared around recreational activities that allow children to have these enriching learning environments, to be with their peers, to have fun, but also provides this kind of break for the parents. So those 7 components make up our entire comprehensive post-permanency model, or our MAL. Of course, the glue amongst all of this is case management, because without case management, it's hard to connect all of these together. So that is our post-permanency model. We're going to move on now to evaluation and CQI. And as we move to the next slide, I will introduce Sharon and then I will bring her on and then I'll let her introduce herself. But Sharon Van de Veer is from Child Trends. She's our lead evaluator, and she's going to be talking about CQI and how Child Trends will be helping sites with that really important process.
Thanks so much. I'm really glad to be here and working on this important project with all these great collaborating agencies. I'm with Child Trends, which is a national organization, nonprofit that is dedicated to improving the lives of all children and families by carrying out applied research to inform public policies and build the evidence for what works. So, as I said, we're really excited to be involved. And I know Melinda mentioned early on that we know this too, that sites have a lot going on. They don't have a ton of extra time, if any, for evaluation. And for us to burden them with a lot of questions and surveys. So I want to make 2 main points at the beginning, which is that our role is not to evaluate the sites, it's to evaluate the work of the center. And the second point is that we are hoping we can be a source of technical assistance for you on any needs related to data collection or CQI. So the second slide is going to give you, or the next slide I should say, is going to give you a little bit of an overview to the evaluation we're doing of the center. So we're looking at 2 primary questions. One is if the post-adoption center's work is helping you all to implement the post-permanency support model. And the second one is, does this work of the post-adoption center then translate into better outcomes for children and families? So it's not looking at, do the specific interventions you have in place, how effective are those? It's whether you are finding the post-adoption center effective in helping you to implement a full range of services, and does that in turn improve child and family well-being and stability? I will say, though, that we are going to contact a few folks periodically because we do want to get your input onto how you feel that your work is going with the post-adoption center. So the next slide, please. So Melinda mentioned the green pillar, the ability to assess family outcomes. That's the one that is nearest and dearest to our hearts at Child Trends. And we are hoping to be able to help track outcomes for children and families, both to support your capacity and also as part of the evaluation. But we know that it is extremely challenging to track families post-permanency. So we're going to start with a little poll, and we'd like to get your input. The question is, do you have access to information on how many children adopted from foster care subsequently re-enter foster care? So you can check A, it is not available. B, yes, for almost all children. C, sometimes and or information may be incomplete or accurate. And then D, only for some jurisdictions, but not others. E, both C and D, meaning it may be incomplete or inaccurate and only for some jurisdictions. And then lastly, not sure. So I know that's a lot of responses, so I'll give you a minute to fill those in. Okay, it looks like people have, oh, there's a couple more responses. Alrighty. So actually it looks like most of you or many of you are able to have some data on whether children re-enter foster care or not. So that's really great. That'll give us a lot to build on. So this information is going to be pretty helpful to us. So let's go to the next one. I have another question that asks about processes you have for staying in touch with families, because that's something that if you want to strengthen your capacity, that's something that you can build on in your ability to track data on children and families. So what direct contact does your state have with families after adoptions are finalized? And it could be any kind of contact, a letter, phone call, email, whatever. So A is none. B is periodic communication to recertify the adoption subsidy. C is periodic communication offering information about supports and services or asking how the family is doing. D is both of those two above responses, periodic communication regarding the adoption subsidy and to reach out to the families about supports or see how they're doing. And then E is you're not sure. Okay, I think most people have answered. So this is actually really great too. Everyone has some sort of communication. One individual is not sure, but this also gives a lot to build on. So thanks for sharing that information with us. Then if we go to the next slide, I'm going to talk a little bit about our involvement in CQI. So again, our active involvement in carrying out CQI is going to be with the Post-Adoption Center. We're not going to be carrying out CQI for you all or for any of the programs that are being implemented in your sites. However, we hope to be able to provide some technical assistance with how you can do that. So the little figure in the center there looks at the overall cycle for CQI, continuous quality improvement. So step one is to collect and analyze data, which is the blue block on top, and then going clockwise, interpret the findings from the data and consider changes to the Post-Adoption Center. And then the next one is implement those changes, hopefully to improve the way that the center is working with the sites. And then the fourth step is that will be to develop a new analysis plan to see if those changes were made and if they were helping to improve the center's work. And then the last one not shown is just the arrow, which is repeating the cycle throughout the 5 years so that hopefully the services will become better and better and more effective for you. So as I mentioned, Child Trends is not carrying out CQI on the sites themselves, but our role also, in addition to the evaluation and CQI, is to provide TA to you all as desired to carry out your own CQI for sites that are interested in this. And a key area is, as I sort of suggested before, figuring out how to track families post-permanency or improve your capacity to do so that we can so that everyone can better understand how families are doing post-adoption, what kind of services they need, and identify that before crises hit. And let me see if I had anything else that I wanted to share with you on the evaluation. I did want to mention, if you are already collecting data in a way that works for you, we don't want to force you to change the way that you're doing it. And in fact, we'd love to learn more about it and perhaps share that with other sites who could benefit from what you know. So we can go on to the summary slide. That's it about the evaluation and CQI. So overall, what you've heard today about what the center can offer you is a plethora of opportunities to learn from experts, including other sites. Second, the center can help you get resources, tools, and connections with other sites related to post-permanency. Third, the center can complete an assessment of your post-permanency system and help you move your site to a comprehensive post-permanency model. And then fourthly, the center can help cover some of the costs of implementation and connect you with training and opportunities to enhance your overall post-permanency system. So that is all I have. And then I think we turn it back over to Melinda now.
Yeah, so that's pretty much the end of this presentation. My information is up here. You can email me directly. There's also an email for the Post-Adoption Center that goes to different people on our team. And then our website is listed here as well. And I do want to remind people that we have the information up or will very shortly about all those great center chats that Dejari talked about and the webinars. So we really encourage you to get on there. It's a very quick just registration to sign up for the sessions. And we'll have peer-to-peer stuff up very soon. The library is up and ready to go, and people can contact Dejari now. They can also reach out for universal assistance. So I know there's been a couple of chats or a couple of questions and things going back and forth in the chat. I'd encourage people to put any questions they have for us there. If you don't feel comfortable doing that in this audience, you certainly can reach out to us and have a private conversation, which is totally fine. But we really look forward to working with all of you and to figure out how we can partner together to really enhance your services continuum for post-permanency. So Alicia, I'm going to let you lead this last piece here.
Great. Thanks so much. Well, Melinda, Dejari, and oh my gosh, I'm sorry, Sharon, glitch on the name. Thank you all for all of that information. It was really helpful, really interesting to hear. Each time I hear more about the center, I get excited, even more excited about how this fits with what I hear from so many child welfare systems about their needs. So this is great. I have been collecting a few questions that have come in, some sent just directly to me, so you may not have seen them in the chat, and then some that I want to build on from things that are in the chat. One question is, I guess, as it sounds like you're going to have more than one peer group. So will people be able to sign up for more than one peer group, or do they have to pick one?
No. So I think, hopefully you can see me. Okay. You can sign up for as many peer groups as you would like. So we are going to start with one peer group because we're doing a little bit of a pilot. We're not sure. You know, we tried to get some information from the listening sessions, but I think we still want to see what is going to be best for sites. And so the first one we're going to offer is going to be kind of a one-time deal. It'll be a 3-part series, as Dejari mentioned. You sign up for that. You know, we'd really like you to attend all 3 of those sessions. And then there'll be a tail to it that allows people to have ongoing conversations and back and forth between each other related to that topic. And that topic is going to be really related to funding and innovative ways to do funding related to post-permanency programs, which is a topic many states have told us they're interested in. And then if this goes well, our plan is to offer more of that same peer group more than one time. And as we go through those sessions, those people would go into the same tail that the other peer group is in, so that it would just broaden that kind of peer-to-peer group that would be able to continue with communication and ongoing learning. And if it works well with that, we'll move on to different topics, and then people can continue to join them, you know, on any topic that they find is beneficial to their role.
Great. Thanks for that. Another question was, you had mentioned, Linda, that you are able to offer TAC training, I think, to the TA sites. I'm wondering if the question was, can you talk a bit more about how you're able to offer that TAC training? And some places I think are already buying that service separately. So that was the question about how it fits in your TA, and I guess more detail on what's being offered there.
So we basically are going to be offering that to any of the sites that are receiving on-site technical assistance. They'd be able to join a cohort of people that are going through TAC training, and the costs are being covered by the project. So the sites do not have to to deal with that piece of it. And speaking of that, I didn't mention it earlier. I don't know how I forgot. One of the things that sites, that one of the benefits is that we do have funding to provide to the sites related to post-permanency. So this TAC training wouldn't be one of it. That's an extra thing. The TBRI is an extra thing. The groundwater analysis is an extra thing, but we will have funding that a site can use to basically help build their program related to post-permanency. So that may be that they need to bring in a purveyor for a training that they want to do, or that they have some type of data tracking that they want to put in place so they can do better tracking, whatever it is, as long as it aligns with the action plan, we would be able to fund that for the site.
That's great. That may generate all sorts of additional interest and questions coming in, but that's great. I think that's such a great additional part of the resource. And then one thing I saw, Melinda, you had addressed this question in the chat, but I wanted to sort of expand on it because I think it was Kathleen's question, was asking about the idea of talking about what's happening in one state, and are there other states that have similar services they can reach out to find out about. I'm wondering if you or Dejari can speak to sort of that broader piece of those peer-to-peer connections. If child welfare systems are saying we're exploring using this kind of program or implementing something, are there ways that you'll be able to help them connect with who else is doing similar work, or more of that kind of, I don't know, I think of it sort of one-to-one peer-to-peer connections?
Yes. There's several ways that we're going to be doing that. Dejari can add in too, but one way is that we are actually working on site profiles now. So a few of you on the call may have already gotten called by somebody, but all of you will eventually. We're developing a site profile for every single, right now we're working on states, then we're going to move to territories and then tribal nations, so that we have a database up that anybody can access to see what is being provided, because that's something that we've had off and on throughout the years with different agencies doing it. There isn't one right now that's up to date. So this will be something that's being up to date, but instead of a survey, we're doing it as more of a phone interview, and we're trying to capture as much of the information that we can on our own, so that the person on the receiving end, the site, only has to kind of bless it and add more to it based on what we missed. And that information, I think, will be very useful when it's up on the resource library, because it'll allow sites to be able to say, oh, well, who's doing respite? Let me put this in the filter and figure out who it is. And then they'd pull up with all the sites doing respite. In addition to that, certainly all the stuff we're doing, the center chats, the peer groups, well, primarily those two things are really about helping sites to cross with each other and to learn from each other, and really giving those kind of opportunities for that sharing. And then Dejari will be making those connections individually with sites as they contact us for questions or individualized assistance, is to really, for us to be the holders of what's going on out there, so we can connect people based on that.
That's fantastic. As you all know, probably better than I do. I mean, that's the question that people have, is who else is doing this? What's working? How are people approaching this? So that's really exciting to hear about that whole database and the profiles, so people can really find out what else is happening around the country and who should I be connecting to and learning from, or, strategizing with if we're both facing the same challenges. So that's great. All right. Well, I think those were all the questions that I have seen come in, or that I have even sort of taken and adapted to pose to you. I just want to see, Linda, Dejari, Sharon, any final things that you'd want to add that have come up, or that these questions kind of spark for you that you want to make sure you highlight?
Anything, Dejari or Sharon? Nothing from me.
No, nothing for me. Just thankful that everyone attended, and I hope that the information we presented was informative, and that you visit our website soon.
And I'll just echo Dejari. Thank you, everyone.
Great.
We do have one plug I'm going to put in there, is our listserv. If you have not signed up for the listserv, we really encourage you to do it. Not because we just want to grow our listserv, but we're going to be putting out every month a really cool item. And this coming month, March, we're putting out about proactive outreach, which is a document that was developed by someone on our team. And I think it's one of those areas that sites need. We're going to have another one on normalizing the need for assistance post-permanency coming out in May. And in April, Dejari, I would keep forgetting, what is the one we're having? It's on...
In April, we have the one on the therapeutic web, building a therapeutic web.
Yeah, so we have great stuff coming up. If you sign up for the listserv, you'll be the ones to get those and to know about the center chats and the various things that are being offered. So please visit our website and also sign up for that listserv so that you can stay informed.
Great. That was a great final plug. Well, thank you all so much. This was really informative, and I can see interest and excitement in the chat. So I expect you'll be hearing from a lot more people. And Dejari, you're going to have lots of people wanting to chat with you as you dive in. So yeah, get ready for that. All right, we're going to just do a few more pieces here to wrap up today. So let's go to the next slide. Here we just want to note, as I said at the beginning of today's webinar, June Dorn, who's not able to be with us today, she is the National Adoption Specialist at the Children's Bureau. She is also the Federal Project Officer for this National Center, for the National Center for, I'm sorry, we didn't get this slide updated, for the National Center for Enhanced Post-Adoption Support. She is also the Federal Project Officer for the other two national centers that have been funded recently. So the National Center for Adoption Competent Mental Health Services and the National Center for Diligent Recruitment. And June does welcome hearing from any of you with questions, comments, feedback about these national centers and about how they're supporting your work. So she wants to be sure to have her email address here available to you, so you can feel free to reach out to her. Let's go to the next slide. We do, as always, have an evaluation survey for this webinar, for this event. We really do value your input and feedback for our ongoing evaluation for these Center for States events, and for looking for ways that we can continue to improve how we support our peer groups. And today we have the Foster Care Managers Peer Group and the Adoption Managers Peer Group with us. So when this webinar closes, you will have a link to an evaluation survey pop up in your web browser, or you will have the survey itself pop up in your web browser. Please do take a couple of minutes to fill that out and give us your feedback. That's very helpful for us, and we appreciate you taking that time. And then we'll just close out here with our last couple of slides, just noting you can always stay connected with us at the Center for States and get email updates from us and email newsletters announcing upcoming events, new resources, all of that, announcements from the Children's Bureau. And I just want to thank all of you for joining us today. I want to thank our Center for States team behind the scenes as well as in front here, who help make these events possible. And again, on behalf of the Children's Bureau, I want to thank you for joining us. I know June would want to thank you for being here, and Jennifer Lee would want to thank you for being here as well to hear about this great resource. So with that, we will wrap it up. Have a great rest of your day. Thanks, everyone.
Thanks, everyone. We will close the webinar now.